Good evening and welcome. Tonight, Presidential Task Force on COVID-19 raises concern over shortage of bed spaces at Lagos isolation centers, confirms about 113 health workers have been infected in line of duty. Plight of Almajiri children in the north comes under the spotlight as 21 of them test positive for coronavirus in Kaduna and Bauchi states. Ekiti State Governor Kayode Fayemi appoints father who rejected his son for traveling during lockdown as COVID-19 ambassador. And U.S. President Donald Trump draws up long-term plan to punish China on multiple fronts for coronavirus pandemic, alleges it was a plot to distract his re-election bid. Plus business, news from the FCT Abuja, and later from our studios in London.
On business news, CBN extends deadline for compliance with the recapitalization requirements for microfinance banks in Nigeria.
On sports news tonight, France Professional League Board confirms Paris Saint-Germain as champions after ending the season owing to the coronavirus pandemic.
And from Abuja, federal government asks civil servants on grade level 14 and above to resume work on Monday, May the 4th, as preparations heighten for gradual easing of the lockdown.
The Presidential Task Force on COVID-19 is appealing to property owners around the country to assist government by allowing their empty buildings for use and treatment of patients. The appeal was made in anticipation of a spike in the numbers of those infected after the easing of restrictions across the country. The Director General of the Nigeria Center for Disease Control at the daily briefing in Abuja says there are currently only about 3,500 bed spaces across Nigeria.
We will take the remarks.
The unprecedented increase in the number of COVID-19 cases reported in the last 48 hours is perhaps one of the few experiences that has given the Presidential Task Force a serious concern since it was inaugurated over 1 month ago. The Nigeria Center for Disease Control recorded 391 new cases of COVID-19 between Tuesday and Wednesday. The Presidential Task Force says, though not unexpected, the situation raises serious concerns about the number of bed spaces across the country.
Across the country, we have about 3,500 bed spaces identified as available for COVID-19. But in Lagos, we're already struggling. And so we're going to work with them to keep trying to make more spaces available. But ultimately, we might have to change our strategy a little bit. Start considering home care in certain circumstances where firstly you're able to provide a room where a patient can be managed sufficiently. We might have to adapt our strategy because of the realities we face over the next few days and weeks. And as we do that, we'll make that clear to Nigeria. Our policy hasn't changed, but the pressure is there, and that might have to change in the next few days.
Bed spaces and isolation centers at state level need to match this increase and necessitates my appeal to all citizens, especially property and hotel owners, to recognize the imminent needs and the social responsibility of working with state governments and the federal government to make facilities available for temporary use in emergency situations.
The chairman of the task force also informs the gathering about efforts to assist the Kano state government to manage the pandemic.
The Presidential Task Force has released a number of equipment to be transported immediately to Kano to beef up the response. These include 2 oxygen concentrates and 3 ventilators, medical masks and surgical caps, and infrared thermometers.
Over 100 health workers have been infected with the disease, many of whom the health minister says are staff of private hospitals secretly treating COVID-19 cases.
I once again call on all health workers to stringently follow laid down standard infection prevention and control measures at all times and not to take any risks. We cannot afford to lose the service of essential manpower at this time. There are not so many people in the health sector who are infected. The latest figures we have is that there are about 113 actually, and these 113 are not all public health workers. There are some, for a good number, from private hospitals.
There are already over 1,700 confirmed cases of COVID-19 in Nigeria. Many are anticipating that the figure will rise as the government gradually relaxes the lockdown to resuscitate the economy.
Ahead of the gradual easing of the lockdown order by the federal government to curb the spread of COVID-19, specific guidelines have been provided by the Presidential Task Force. The measures, which are designed to manage the pains of the economic disruption and strengthen public health response to the virus, will span over 6 weeks, split into 3 tranches of 2 weeks each. According to the PTF, overnight curfew will be applicable nationwide from 8 p.m. to 6 a.m. daily, effective Monday, May 4th, 2020. All interstate travel is banned except for goods, agro-products, petroleum products, and essential services. All passenger flights remain restricted, and mass gathering of more than 20 people outside of a workplace is strictly prohibited. The guidelines direct the management of various offices, premises, and businesses that will be gradually reopened to, among others, ensure fumigation and decontamination, adhere to physical distancing, use hand sanitizers and hand washing facilities, and the mandatory use of face masks. Well, some have reported that during the lockdown there have been violations of human rights by security officials, especially here in Lagos, in Ogun, and in the FCT. Say the situation has continued unabated with reported cases. We will take more attention now to this by joining us from Abuja studio, Mr. Mike Ejiofor, the former director of the Department of State Services. He joins us from our studio in Abuja. Thank you, Mr. Ejiofor, for joining us on the News at 10.
Thank you.
And I'm sure that you have heard, some of these stories of people who either have been exploited by security agents or who have, come under, some form of abuse by these security agents. Do you think that, this is as a result of the lockdown itself, or this is just a general problem, of the relationship that exists between security agents and citizens?
Well, I don't think it's entirely the lockdown issue. You see, there have been problems between members of the police and between the members of the security forces and the members of the public due to lack of understanding between both parties. And it was compounded by this issue of lockdown, where the security officials would try to exploit the situation by going outside their mandate to enforce the regulations. So I think that was what complicated that. We recorded some issues of abuses. It's not unexpected, but I believe that we can still improve on the relationship between our security forces and members of the public.
And how can we improve the relationship? Because from next week, we go into a different phase, of the lockdown with the easing of the restrictions. But bearing in mind, there will be a curfew from 8 p.m. to 6 a.m.
Well, you see, the enforcement of curfew is not going to be as difficult as enforcement of other regulations. Why I say this is that the issue of the face mask, yes, one can that can easily be enforced, but movement. Take Lagos for instance. People who are living in distant places are expected to be in their homes before 8 o'clock. Somebody from Victoria Island or any of the Ikoyi and any of those areas moving to Agege, for instance, and is held up on the road, is going to have problems with members of the security forces. In fact, my problem is not the issue of enforcement now. My problem is that we should be able to identify what exactly we should look inwards to look for solutions to the cure of this pandemic. Because very soon, unfortunately, we are going to have a spike in the community spread. Not just the community spread, we are going to have problems with the elite spread because there are some people, some of the elites, who are concealing their status because of stigmatization. And I don't see why they should be doing that. So coming back to the main issue, we have a problem of enforcement because Monday, for instance, where there will be partial lifting of the lockdown, is going to be chaotic. So I believe that our security agencies must be up in their game, draw out strategies, look at the ways of trying to enforce it, because especially at the banks, the markets, it's going to be difficult, I must tell you, to control or enforce some of these regulations within the first week. Because staying at home for 6 weeks, I went on isolation a week before the federal government declaration of the lockdown. You see, people who have been locked down and there are no palliatives. The palliatives we are hearing of, you hear bag of rice, mostly from individuals and not from government. And that is creating a lot of problems. The first week of this, I think, is going to be very chaotic, and the security agencies must be ready to tackle the challenges associated with it.
And you do also understand, and I'm sure you observed that, there were quite a number of security issues, especially here in Lagos, during the lockdown. But we've also seen, a great reduction in some other violent crimes, such as attacks, kidnapping, banditry. Do you think that more special measures should be taken to make sure that even after the lockdown, these, violent crimes are kept at their lowest still?
Well, for the issue of Lagos, most of the challenges we're having in terms of control are in the major cities. You talk of Lagos, Kano, Abuja, the Federal Capital Territory. Those are the areas we expect some challenges. And there's going to be upsurge in crimes associated with this partial lifting of because the criminals on their own part were locked down. So they must go out to look for what they're going to do. So there's going to be upsurge in criminal activities. That's why I say that our security agencies, especially the police, must draw out strategies to check this likely upsurge. But at night, it's going to be easy during the curfew that people are not allowed to move around. So it's going to be easy at night. But during the day, I expect a very chaotic situation, especially the first 2-3 days.
Mr. Mike Ejiofor, thank you again for joining us on the News at 10. We do hope authorities are listening. And, of course, we all want the safety of lives and property. Thanks again.
Thank you.
To Kaduna State now, where the Ministry of Health has announced that 16 of the 17 new COVID-19 cases in the state are Almajiri children recently sent to the state from Kano. The ministry also clarifies that one of the 17 cases announced by the NCDC as a fresh positive case was a repeat test from an existing patient, and the attention of agency has been drawn to it for correction. The State Commissioner for Health, Dr. Amina Baloni, who confirmed this in a statement, says the test results of the 16 Almajiri children returned positive from a sample of 40 persons whose test results were released today. Staying in Kaduna, officials of the state COVID-19 security task force have arrested another 45 Almajiri children smuggled from Niger State to Zaria. The Commissioner for Human Services and Social Development in the state, Hafsat Baba, confirmed the incident to Channels Television. She says the truck conveying the Almajiri children was intercepted by security operatives at a toll gate along the Kaduna-Abuja Expressway, and the occupants moved to the quarantine center. The commissioner asked that another set of 25 Almajiri children were intercepted at Curfew local government area while they were being smuggled into Kaduna from Katsina State. 4 Islamic teachers, popularly known as Malams, were arrested for trying to smuggle the children into Kaduna. We'll have more on the movement of the Almajiri children. Plus, Yobe State records its first confirmed COVID-19 case and discovers 3 more cases. Stay with us. Welcome back. If it has joined us, you're watching the news at 10 live on Channels Television Lagos. A reminder of our top stories. Presidential Task Force on COVID-19 raises concern over scarcity of bed spaces at Lagos isolation centers. Confirms about 113 health workers have been infected in the line of duty. Plight of Almajiri children in the north comes under the spotlight as 21 of them test positive for coronavirus in Kaduna and Bauchi states. Ekiti State Governor Kayode Fayemi appoints father who rejected his son for traveling during lockdown as COVID-19 ambassador. And US President Donald Trump draws up long-term plan to punish China on multiple fronts for coronavirus pandemic, says it was a plot to distract his re-election bid. So news from Abuja, the FCT, and later from our studios in. Our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android TV, Fire TV, and Roku. The issue of Almajiris remains a source of worry as 42 samples of returnees from Kano State to Bauchi have been collected for COVID-19 testing, while 5 returnees from Kaduna are reportedly showing symptoms of the virus. 7 doctors have also gone into self-isolation after coming in contact with a COVID-19 patient. Governor Bala Mohammed gave the details during the inaugural expanded weekly briefing of COVID-19. Our correspondent Hajara Aliyu reports.
It's the first time Governor Bala Mohammed leads the COVID-19 task force to address journalists about the latest situation on the pandemic in the state, informed by the sudden jump in figures. The palpable frustration in this room is the number of imported cases from other states into Bauchi due to the porous borders, despite claims by the Commissioner of Police that 17 borders and 11 illegal routes have been identified and closed.
Out of the 78 that we got from Port Harcourt, 2 are positive. 11 returnees from Lagos are under screening. 193 Almajiris from Plateau. Only the man has symptoms and is going to be treated. 42 Almajiris returning from Kano, which is a high-risk area. All their samples have been taken and they have been quarantined.
They said of almost 100 Almajiri moved from Kano to Gumu, and my DPO went there and they verified almost 50 of them. There are some Malam that took them from Kano. It is very unfortunate that they accepted them into the community without passing due process.
So far, the state government has officially received 345 Almajiri returnees from 3 northern states. The government is adopting community engagement approach, especially in rural communities, for active case search and response to control the pandemic.
We are now incorporating, in addition to the 60 people currently in the surveillance, we want to incorporate the 6 from each of the local governments so that they can go and do active search from the respective local government.
Since the outbreak of coronavirus in Bauchi State, 474 people have been tested. 7 doctors have gone into self-isolation, and at the time of this report, there are 29 confirmed cases in Bauchi State. Hajira Aliyu, Channels Television News.
Meanwhile, the Bauchi State Governor has mandated the use of chloroquine and Zithromax to treat coronavirus patients in the state. The governor also accepts responsibility for consequences that may result from the use of the drugs. He says from personal experience, he believes the drugs are effective and advises health personnel to ignore warnings from health experts abroad.
These increases that we have recently, about 18, has risen our own cases to 29. 6 have gone, 23 on admission. There is no death. Our medical team are using their own acumen to use chloroquine and Zithromax and other things, even though in some places they said it is not protocol. Me as a governor, I have taken responsibility. I don't want anybody to die. I have given you directive, you must use something that I have used to get well, and you have used for all the others to get well, rather than saying that something is harmful when we are used to taking chloroquine in Nigeria. We should not follow what the Oyebo people are saying, not taking anything and dying. We have taken responsibility, and I have taken responsibility. Zithromax and chloroquine are not harmful to our body. Our physiological system is adapted to it. If there is malaria, we take chloroquine.
Going to toss it over now to Linda Kigbe in Abuja for more on the news at 10. Hi, Linda.
Hello, Amarachi. Now, staying with COVID-19 stories, Yobe State has confirmed its index case of coronavirus in the state. The state deputy governor, Idi Bade, who doubles as a chairman of the COVID-19 committee, says the patient, a 29-year-old man, had no travel history. He also explains that 3 samples of suspected cases were sent to Maiduguri, Borno State on Monday, in which 1 was returned positive. According to him, the committee has immediately swung into action to trace the contacts of the patient and have so far isolated members of his family. The committee called on the public not to panic, but observe all the precautionary measures put in place, which include social distancing, hand washing with soap and water, among others.
A 29-year-old man who developed symptoms on the 23rd, 4th, 2020. He presented to State Special Hospital, Damaturu, with complaints of fever, sore throat, and cough of 3 days duration. This was no preceding history of contact with suspected nor confirmed case of COVID-19, and no history of travel to high-risk states. The rapid response team has swung into action, and the following were done: aggressive contact tracing and quarantine and or self-isolation.
Nasarawa State now has 3 confirmed cases of coronavirus. Governor Abdullahi Sule announced this during a press briefing at the government house in Lafia, the state capital. He said the 2 additional cases were residents of his state who recently returned from Lagos and have been quarantined alongside 38 others. The 2 new cases have also been taken into isolation at the Dalhatu Araf Specialist Hospital in Lafia, where the index case is receiving treatment. The Edo State government has extended the curfew imposed on the state towards curbing the spread of coronavirus for another 14 days, this time with a new time of 8 p.m. to 6 a.m. The Edo State Governor, Godwin Obaseki, stated this during the COVID-19 response team briefing at the government house in Benin City, the Edo State capital. He also announced a second round of palliatives to mitigate the impact of a new restriction. Mr. Obaseki also declared wanted one Amaka Okoro for running away from an isolation center after testing positive for COVID-19. He advised residents to go for screening as early detection will improve chances of survival for any positive case.
I'm advising everyone to come out and get screened at the numerous screening centers across the state so that you can save your family and friends the agony and pain caused by the loss of a loved one. Therefore, I am extending the curfew in Edo State for another 14 days. This time, it will be from 8 p.m. to 6 a.m. That we are looking for one Amaka Okoro, who lives at number 2 Atoi Idubo Street off 2nd Ugbo. She has disappeared since yesterday and disappeared with a baby. She's infected, and we believe that baby may also have been infected. We want to get them. I want to bring them to treatment as quickly as possible.
A man who was seen in a viral video rejecting his son for sneaking into Ekiti from Lagos has been appointed by Governor Kayode Fayemi as a COVID-19 response ambassador in Ekiti State. The man, identified as Mr. Adioye, a former road safety officer, rejected his son due to the fear that Lagos remains the epicenter of coronavirus in the country. Insisted he did not want to take chances by allowing his son into his house because he might have been infected. Governor Fayemi made known Mr. Adioye's appointment in a tweet today, stating that he represents the kind of self-discipline, selflessness, and sense of collective responsibility that Ekiti State and Nigeria needs desperately today to progress.
As an intelligent officer, I know it's a risk to this Ekiti community. Immediately, I have to inform the NCPC and the security agents. Don't allow that person to come in. I'm doing this not because of my son, but because of the reality of Ekiti people.
When the News at 10 returns, we have more updates on COVID-19, plus CBN extends deadlines for compliance with recapitalization requirement for microfinance banks by 1 year. Join us again.
Welcome back to the News at 10. As the country looks inwards for solutions to the COVID-19 pandemic, 25-year-old engineer and entrepreneur Jerry Malo from Jos in north-central Nigeria has joined the league. Along with his team, Mr. Malo has put together a ventilator using locally sourced materials. He says the need to give victims of COVID-19 a chance to live was the inspiration behind his innovation. Jerry also adds that although the product is fully functional, there is, however, room for an upgrade.
Gone through the clinical test. There have been high demands of ventilators all over the world. African countries have been faced with the challenge of getting cheap and affordable ventilators. In some situations, you may even have the monies to buy the expensive ventilators, but they are not available for purchase. Benny came up with the design of making cheaper ventilators with parts that could easily be accessed within our country. This machine could be efficiently put to use if improved upon. If we have everything needed in place, Nigeria will be a proud manufacturer of its own ventilators.
And Lafarge Africa has deployed a 500 million naira intervention fund to provide medical infrastructure, food and essential medications to its host communities across the country. The company converted 2 of its facilities in Shagamu and Ashaka to be used as isolation centers and also provided infrastructure support such as generators, ambulances and critical personal protection equipment for health officials and its host states.
Different food items packed in one bag, 60,000 beneficiaries across 10,000 families. In Lagos, like every other state, the target group is mostly retirees. And with the collaboration of the government or the grassroots, those who truly need the materials are selected. But safety first. Chief Shotunde Shokweju, a retiree, is one of the beneficiaries. He says the palliatives would help many ease the economic hardship they face, especially this time.
This palliative will go a long way to satisfy me and my extended family.
The local government chairman and the representative of the Lagos state government are appreciative of the company's gesture.
It's a big challenge to all the national, international, multinational companies that are bound in this council. Quite a number of them, without mentioning them, that are thrown tons away. They have not deemed it fit to come and partner with the council to have done this, and that is why we are highly appreciative to Laval.
It will go a long way to complement the efforts of the state government and giving palliatives to our people.
Lafarge Africa PLC, we present to you this relief material.
The Building Materials and Solutions Company also distributed food packages and medical essentials to royal fathers and chiefs across its host communities.
We've reached out to all the local government areas in Lagos because we operate in Lagos. We've done Ogun State, we've done Gombe, we've done Cross River State. So we've tried to reach out as much as we can, especially to where we're operating. And Lagos is a mainstay. So we've ensured that we've reached out to all the local governments, and we've identified over 60,000 households who really need this help, and we've reached out to them.
Lafarge Africa says its operations are built on the key pillars of sustainability, health and safety, mobilizing resources at their disposal to offer relief to Nigerians, as well as collaborating with government agencies at all levels to build enduring structures to end the pandemic.
Coyote has more on the CBN extending deadlines for microfinance banks and other business stories. Next.
Well, thank you, Amarachi, and you're welcome to Business News. The Central Bank of Nigeria has extended the deadlines for the recapitalization requirements by microfinance banks by 1 year, and this is due to the impact of COVID-19 in the country. The financial regulator in a circular says the directives affect microfinance banks operating in rural, unbanked and underbanked, urban and high-density areas, as well as microfinance banks at state and national level. The Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, says the $3.4 billion loan by the International Monetary Fund will be used judiciously to alleviate the impact of COVID-19 pandemic on the economy. Mrs. Ahmed, in a tweet today, said the fund comes at a time when the country is grappling with a sharp fall in crude oil prices, which has led to a drop in reserves. The Finance Minister adds that the financial support will provide finance into the budget for targeted spending and will also give short-term focus on fiscal accommodation. And now to company news. Access Bank PLC has held its 31st annual general meeting, its first after the merger with the defunct Diamond Bank. The bank's management says it has achieved a strong business growth and profit from the merger and will continue to build on that success. The board proposed a final dividend of 40 kobo per ordinary share, which will result in a full-year dividend of 65 kobo per ordinary share.
This is not a regular annual general meeting. Public health and safety precautions in response to COVID-19 have necessitated a different arrangement here. Attendance to this meeting is by proxy. Shareholders, regulators and other stakeholders get a representation either in the room or on the digital platform.
I now declare the meeting open.
The gross earnings as at December the 31st, 2019 show a 26.1% increase. The profit before tax stands at 11.8%, and the bank posted a 2.7% profit after tax. The level of the key performance indicators appears to be pleasing to the shareholders.
Thank you again about your views about our results.
After deliberations, the total dividend to be paid for the 2019 financial year was declared.
I hereby move that a final dividend of 40 kobo per ordinary share or 50 kobo each be sanctioned, and that the directors be and are hereby authorized to pay same from the profit during the financial year ended December 31st, 2019 to members of the register on the register of the company. at the close of business on April 14, 2020, subject to the deduction of appropriate withholding tax.
Time to vote for the appointment of the company's board of directors, dividend payment, and selection of auditors.
It's going to take a little while for us to basically go back to what will be the new number.
The group managing director speaks on the post-COVID-19 economy and sustaining investors' confidence.
COVID plus crash in oil prices is going to bring what is definitely going to be a recession, and it has nothing to do with just Nigeria, it's world over. So we need to prepare ourselves. Institutions need to basically build sufficient capital buffers and liquidity buffers for the difficult times ahead. Shareholders have to understand that these are going to be very trying times, and give management and of course the board some flexibility in terms of managing themselves from a cost standpoint, while ensuring that they meet the diverse needs of the stakeholders.
Access Bank has a customer base of over 40 million, and its management says it is confident of solidifying its position as a well-diversified African financial institution with commitments to strong corporate governance and effective strategies.
The Federal Inland Revenue Service has issued a waiver for interest and penalties on outstanding tax debt from desk reviews, tax audits and investigations. The Revenue Agency, in a public notice issued today, says that defaulters can only access the concession if they pay their debt in full on or before May the 31st, 2020. The announcement follows its earlier palliative measures to mitigate the impact of a COVID-19 pandemic on taxpayers. Let's head over to the stock market, where the equities market witnessed a fourth straight day of gains as the all-share index climbed further by 0.67%. BC Adebayo now gives us more details.
Hello and welcome to the Stock Markets Report. It's a fourth straight day of gains at the equities market, with the all-share index climbing further by 0.67% on the back of a sustained increase in the share price of MTN Nigeria. Gains from NEM Insurance, Wapik Insurance and Lasaco Insurance pushed the insurance index up by 1.22%, while the 10% and 5.53% gain from Adova and Wando lifted the oil and gas counter by 1.04%. The industrial goods sector was down 0.47%, and that was due to losses from Boa Cement. Adova led the day's gainers with a maximum 10%, while Prestige Assurance was the topmost loser with 9.09%. Total volume came in at 359.46 million, valued at 3.25 billion naira in over 4,900 deals, and that was largely driven by the shares of Access Bank, FBNH, and GT Bank. And that's it on the stock market reports. I am BC Adebayo.
Well, outside the country, global markets wrapped up their best month in decades, and that's despite stocks falling sharply on the last day of April. Here are some of global market figures for Thursday. Well, thank you for watching Business News Tonight. I am Kayodoki Kyolu. It's back to Amarachi on the news at 10.
Thanks, Kayode. Still ahead of the news at 10. U.S. President Donald Trump draws up long-term plan to punish China on multiple fronts for coronavirus pandemic. There are more international stories from our London studios from around the world in 5. Stay with us. US President Donald Trump says China will do anything they can to make him lose his re-election bid, stepping up his criticism of Beijing amid the coronavirus pandemic. He says China faces a lot of consequences from the US for the outbreak, as it should have let the world know about the contagion much sooner. China has responded, saying it is groundless for Trump to consider punishing China, as both countries share victims of the pandemic. Here's Simon Pusey now with more international news and around the world in 5.
Good evening and welcome to the Channel Studios in London with your international news around the world in 5. The number of fatalities recorded overnight in Spain fell to 268, the lowest tally in nearly 6 weeks. The overall death toll there has risen to 24,543. 4 days before Italy begins to gradually lift strict lockdown restrictions, people across the country are increasingly frustrated by the social and economic problems that the 2 months of quarantine has brought. Doctors and nurses in Turin demonstrated outside their hospital on Thursday over the lack of personal protective equipment for workers dealing with the new virus. Meanwhile, in Rome, a small group of workers protested outside the Prime Minister's office to demand government help as they struggle to pay rent, mortgages and bills. South Korea has reported no new domestic cases for the first time since its peak in February. That's according to the Korea Centers for Disease Control and Prevention. 4 new infections, all imported cases, have been reported, taking the national tally to 10,765. The death toll rose by 1 to 247. Thousands of people have lined up for food parcels amid lockdown in South Africa and the city of Centurion, in a queue that stretched for 4 kilometres. South Africa has spent 5 weeks in quarantine, leaving many businesses and individuals struggling without income in the recession-hit economy. The country has so far confirmed 5,350 cases and 103 deaths. Germany has banned Lebanon's Iran-backed Hezbollah movement from carrying out activities on its soil and designated it a terrorist organisation. That's according to the Interior Ministry. Police conducted early morning raids in mosques and venues linked to the group. Security officials believe that up to 1,050 people in Germany are part of Hezbollah's extremist wing. Protests have grown more violent in several cities across Lebanon, making a third night of unrest. Demonstrators are angry at the country's worsening economic crisis, which has been exacerbated by the virus and its lockdown. The latest wave of unrest comes after a plunge in the Lebanese pound last week, causing millions of people to lose more than half the value of their salaries and savings. In Sierra Leone, 2 prison guards and 5 inmates have died after a riot in Freetown's Pademba Road prison was set ablaze. Firefighters were called to the scene to put out the fire. Details about the cause of the violence are vague, but it followed the recent confirmation of a virus case in the jail. Sierra Leone has so far confirmed 104 cases with just 5 deaths. A massive fire has also broken out at a dump north of Santo Domingo, the capital of the Dominican Republic. Firefighters and locals have been struggling to bring the fire under control as thick smoke blots out the sky and poses a health risk to locals. Local authorities are currently investigating the cause of the blaze, but local media suggest that high temperatures may be to blame. And finally, Tom Moore, the Army veteran who's raised over £30 million for the British NHS, has been treated to a flyover from the RAF to mark his 100th birthday. Among many other birthday gifts, he also received an honorary promotion from the Army, moving him from captain to colonel. After setting out to walk 100 lengths of his garden to raise just £100 for charity, he now holds the Guinness World Record title for the most money raised by an individual from a walk.
I know I speak for the whole country when I say we wish you a very happy 100th birthday. Your heroic efforts have lifted the spirits of the entire nation. I think I first heard about your mission when you'd raised about £1 million, which in itself was extraordinary. And you've now inspired the most incredible generosity, raising over £29 million, supporting the cause closest to all our hearts. You've created a channel to enable millions to say a heartfelt thank you to the remarkable men and women in our NHS who are doing the most astounding job and whose courage and compassion will be why, in the end, we will defeat coronavirus.
And that's your international news around the world in 5. Now back to the Channel studios in Lagos.
Welcome to Sports News. The Nigeria Women Football League Management Committee has confirmed that the champions of the 2019-2020 Premier League season will be determined within 7 weeks. The Elite Women League, which has scheduled to resume on the 25th of March, was suspended owing to the coronavirus pandemic after the federal government announced measures to curtail the spread of the virus. France Professional League Board has confirmed Paris Saint-Germain as champions of Ligue 1 after ending the season due to the COVID-19 pandemic. PSG had a 12-point lead over second-place Olympique Marseille when the season was suspended as part of French government's measures to contain the spread of the coronavirus. Germany's federal and state governments have postponed a decision on fully resuming Bundesliga matches. The German Chancellor held a video conference with leaders from Germany's 16 states to review restrictions on public life that are aimed at suppressing the coronavirus outbreak. And that's it on sports. Back to you, Amarachi.
Thanks, Jeff. President Muhammadu Buhari has extended tenure of Professor Keme Ponde-led Interim Management Committee of Niger Delta Development Commission from May 1st to December 31st, 2020. A special advisor to the President of Media, Mr. Femi Adesina, on his official Twitter handle, said this extension will cover the period of the forensic audit into the commission. Meanwhile, 2 people have been confirmed dead after an 8-story building under construction collapsed along Yaradua Drive in Owerri, the Imo State capital. The Deputy Chief of Staff Operations to the Imo State Governor, Mr. Emeka Agbo, who led a rescue operation to the site, says about 25 people are still trapped. 14 people have been rescued and taken to the Federal Medical Center for treatment. In the meantime, all federal civil servants from grade level 14 and above have been directed to resume their duties effective Monday, May 4. The directive is contained in a communique issued by the head of service of the Federation, Dr. Folashade Yemieson, who explains that the resumption order includes those on essential services across the country. All those mandated to resume on Monday will be allowed to work 3 times a week, while closing time would be 2 p.m. on the relevant days. And the main news again. The Presidential Task Force on COVID-19 today raised concern over the shortage of bed spaces at Lagos isolation centers. The PTF also confirmed about 113 health workers have been infected in the line of duty. That's the news at 10 tonight. Thank you for watching. I am Amarachi Ubani. Good night and stay safe.